Welcome to the Medical Savings and Loan. I've been upset with the low quality of discourse in the healthcare debate. Low quality discourse leads to bad policy, which leads to poor care. I wanted a better debate, but Americans no longer talk to each other. Pundits, left, right, and center, simply engage in parallel monologues with little substantive communication. I prefer real discourse to monologues. Sadly, I've been unable to find anyone interested in discussing real free market healthcare reform, so I created this screencast with my own private monologue. This pithy introduction will define terms with a sprinkling of bad jokes. The second screencast will present an alternative approach to healthcare that I've taken to calling the Medical Savings and Loan. I admit the name Medical Savings and Loan is a bit campy, but the name accurately reflects the direction of the reform. I also like the image of George Bailey standing against big finance in the movie classic It's a Wonderful Life. I believe that it is important to have clean, well-defined terms for a debate. One of my complaints with the current healthcare debate is that the Obama administration failed to give the debate a clean, well-defined name. At the beginning of the debate, Obama instructed his followers to call a specific proposal by the generic term healthcare reform. Using the categorical name for a specific proposal hampers the ability to discuss alternatives. I am for healthcare reform. I disagree on the direction of the reform. Obama's plan centralizes. I favor decentralization. Because the administration failed to give the effort a clean name, the opposition took to using the diminutive term Obamacare. Unfortunately, using diminutive terms in a debate immediately brands a speaker as a wingnut. The lack of a well-defined name for the reform makes it extremely difficult to engage in civil discourse. But we have to have terms to speak, so I will use the term Obamacare for Obama's approach to reform and Romneycare for Mitt Romney's plan. I will refer to the process that unfolded in Congress simply as the healthcare fiasco. In my opinion, this whole healthcare fiasco has been a low point in American history. Neither the administration nor Congress did an adequate job explaining the bill to the public. Even a year after the passage of the Affordable Care Act, I was surprised to find that few people understand that Obamacare is a network of state-run health exchanges. It's absurd. Congress imposed a system of centralized health exchanges without educating the public on the exchanges. The debate reached historic close when, just days before the final vote, Speaker of the House Nancy Pelosi begged support with the words,
"But we have to pass the bill so that you can find out what is in it."
"We have to pass the bill so that you can find out what is in it." Sorry, Ms. Pelosi, but if you fail to educate people on the contents of your bill, then you failed as a political leader. The controversy is not at fault. Unfortunately, the Republican participation in the discourse has been as bad as the administration. Right-wing pundits spent more time projecting negative images on President Obama than engaging in substantive debate about health care. The few Republicans who engaged in debate made absurd blunders like arguing for states' rights in one sentence and for buying insurance across state lines in the next. People who raised questions about health exchanges were as likely to be rebuked by Republicans as by Democrats. Republicans did such a poor job in engaging in debate that, by 2012, I wasn't sure if Republicans were set on repealing Obamacare or if they were just trying to capture the health exchanges for their own. Perhaps the greatest joke pulled in American political history came in 2012 when the GOP nominated Mitt Romney to run against Obama. Obama's health care reform was based on the Massachusetts plan enacted by Governor Romney. In speeches, Romney would promise to repeal Obamacare at one stop, then promise to keep most of the bill in the next. It was a joke. Obamacare was based on Romneycare. Both parties have the same plan. 2012 was one of the most divisive elections in history, but the difference between the parties was negligible. While the party system failed, I could not find anyone willing to engage in true debate. I spent over $10,000 in over 5 years just trying to find someone willing to edit this stupid presentation. No one in the GOP or libertarian movement is willing to talk about substantive approaches to free market healthcare reform. I made my effort because I have something very important to say. I believe that the healthcare debate is based on a false premise. The premise is that insurance is the only way to fund care. I worked as a programmer for the insurance industry. After spending several years analyzing data, I concluded that group health insurance is fundamentally flawed. The public debate starts with the assumption that insurance is healthcare. Both the left and right seek ways to force people into insurance pool. My analysis shows that insurance is the problem and that the solution is to create alternatives to pool insurance. Note, socialism is a pool of insurance at the state level. If we wish to restore the promise of America, We need to create a viable, self-funded alternative to pooled insurance. Here's my problem. The second that members of the GOP realize that I intend to challenge the insurance industry, they show me the door. Being locked out means I have no choice but to engage in my own private monologue. I hate monologuing. This brings us back to the healthcare debate. What would a healthy debate look like? Well, a healthy debate might start by defining terms. So in this first screencast, I'm going to do something radical. I will start by defining the term healthcare. I defined healthcare as the application of time and resources to the care of health. The public debate is not about medicine. It is about how we pay for medicine. Now, long ago, people created a tool for measuring time and resources called money. Since the debate is about allocating resources, people will spend more time talking about money than actual care. This is not a problem. Unfortunately, people have a tendency to assign magical qualities to money. This is especially true in the insurance industry that wants the public to believe that insurance companies have magical formulas that provide more care for less. The opposite is true. Insurance introduces inefficiencies that raise the cost of care. The belief that actuarial formulas are magical is base superstition. We would actually get better care if we broke the insurance pools into individual accounts. I will prove this in the following screencast. There is nothing magical about pools of money. Money is simply a tool that one uses to value resources. A much more important issue is ownership. Ownership is about who has control over resources. By putting the bulk of our healthcare resources in centralized pools, we've concentrated ownership. This concentration of resources has implications that go way beyond simple healthcare. Centralized insurance pools concentrate wealth and power. This is the reason that the current healthcare debate is so shrill and destructive. For the culture war debate is not about health, it is about who controls society. The dialectical left wants society controlled by big government. The dialectical right wants a society controlled by big business. The dialectical center wants a society controlled by a mix of big government and big business. The healthcare fiasco of the Obama administration was deeply flawed from inception. America needs to start a new debate. We need a debate that starts by looking at health. Quite frankly, I'm perplexed. We had a huge healthcare debate in which few people actually discussed health. Don't you find that troubling? It is troubling. In our huge debate on healthcare, I saw few people sit down and discuss the nature of health. So what is health? Health, as it turns out, is simply an attribute of a thing. A thing is healthy if it is in good working order. We can assign the term health to any working system. An internet connection is healthy if you can log in and download pages. A car is healthy if it is in tune and running well. It is in bad shape if it is sitting by the freeway in flames. An economy is healthy if it is growing and producing jobs. A corporation is healthy if it is producing profits. A nonprofit corporation is healthy if it's taking in more money than it spends. By the way, I hate the vilification of the word profit. Profit simply means we got more out of something than we put in. Personally, I think it is wrong to invest resources in ways that diminish the resource. Before cutting down a tree, we should be certain that the thing made from the wood is more valuable than the tree. Think of all of the trees cut down when people printed the pages of the PPACA legislation. Now that was a waste of trees. But I digress. We were talking about the term health. A universe is healthy if... I'm not sure what makes a universe healthy. Many people want universal health care, but how does one judge if a universe is healthy? Universal health care is just two words that poll well stuck together in a sentence used to justify power grabs. People often apply the term health to biological entities. For example, a worm is healthy if it is wriggly and well fed. A horse is healthy if it is prancing in a field. But a horse with worms is unhealthy. You cure a horse with worms by killing the worms. There is no universal health. We live in an ecosystem with a myriad of creatures competing for the same resources. The health of one entity is often at odds with the health of others. This brings us back to the healthcare debate. The healthcare debate needs to start by identifying the objects we wish to make healthy. Currently, we fund healthcare at the group level. This means that the health of the group is our primary concern. So please, close your eyes and imagine a healthy group. A healthy group is young, vibrant, free of disease and debilitating injuries. It turns out there's a very easy way to make any group healthy. Simply remove the sick, elderly, and infirm. This is the way nature does it. This next picture shows two of nature's healthcare providers. The character on the right is talking about the important role that wolves play by culling the herd. The character on the left is looking at you, thinking you just might need culling. The caption reads, "In a meadow with a healthy wolf pack, there are no unhealthy deer." The wolves demonstrate group care in action. The wolves tend the care of the deer by eating the slow ones. The healthcare establishment tells us to hold the group higher than the individual. The way one maintains the health of a group is by culling the herd. There have been many societies in history that maintained the health of the group by killing the weak. For that matter, America was unique in history. The U.S. founders created a new system that held the individual in high esteem. Advocates of radical change claim that we should return to the ideals of feudalism, which hold the group over the individuals. Do you really want the group to be the focus of your health care? The way you keep your skin healthy is by exfoliating dry old skin. The way one keeps a group healthy is by exfoliating the sick and unproductive. When discussing healthcare, one needs to start by identifying the entity of concern. The healthcare system of our parents put the individual first. The radical change of our day is not progress, it is regress disguised with clever talking points. I reject the reform of the Obama administration because it is taking us backwards, not forwards. We are not creating a system for the benefit of the individual. We are creating a system built by the ruling elite to the desires of the ruling elite. The desire of the ruling elite is to care for people as a group. The idea of group care sounds wonderful at first, but since resources are limited and bureaucracy is ineffective, group care inevitably breaks down into a political system that chooses who lives or who dies. Don't you see? The fundamental decision of our day is if we should continue to provide care on an individual basis or to provide it on a group basis. But getting people to discuss this fundamental issue is like pulling teeth. Despite their free market rhetoric, conservatives are as reluctant to engage in a fundamental discourse as progressives. The dialectical split between conservatives and progressives is a sham. It's always been a sham. The idea that conservative is somehow a synonym for freedom is laughable. The U.S. founders were not conservatives. The conservatives of 1776 stood with the British. Conservatism did not create this nation. It will not save this nation. A conservative is driven by a desire to conserve a social order. Conservatives like the top-down social structure created by centralized insurance pools. Conservatives will not permit discussion of alternatives to insurance. The idea that conservatives would stand up for freedom, for the freedom of others, is laughable because conservatives are driven by a desire to preserve a social structure. This next picture shows the Stand Up Freedom Rally in Salt Lake City. Utah is the most conservative place on the planet, with the possible exception of Tehran. Perhaps 200 people from a metro area of 2 million joined the rally. About half the crowd were speakers, press, or direct supporters of the speakers. It was not simple happenstance that the GOP nominated the father of Omnicare to run against the father of Obamacare. It is not coincidence the Republicans somehow forgot to argue against health exchanges in 2009. Conservatives are driven by a desire for a top-down social structure. A true conservative loves the regulated society created by centralized healthcare exchanges. Obamacare creates exactly the structure the GOP wants. The shrill public debate is about who controls the ring of power. No one seeks to destroy it. The ruling elite of both the Republican and Democrat Party want to avoid a fundamental debate on healthcare. But if people understood the fundamental issue, they would reject the left, right, and center. I repeat, the left wants healthcare ruled by big business. The left wants healthcare ruled by big government. The right favors rule by big business. The center favors rule by a mix of big government and big business. I reject all three positions. I want to restore the American system of self-rule, which holds the individual in high esteem. To restore America, we need to stop acting like sheep and break apart the centralized pool. Speaking of sheep, I realize that the healthcare establishment dislikes my analogy of wolves culling a herd. The health establishment prefers a gentle metaphor of sheeps tending a flock. Now, I would like to talk a little bit about the fine distinction between wolves culling a herd and sheep tending a flock, but I have a lamb roast in the oven. A lamb roast that I bought from a shepherd.